Hello, my name is Donna McMahon and I'm a general pediatrician. I graduated from NICOM in Old Westbury in 1987 and went on to do a rotating internship on the west coast of Florida before coming back and completing 2 years of pediatric residency at Winthrop Hospital, before moving out to California and completing my pediatric residency at Oakland Children's Hospital. I then went on to work for Kaiser Permanente for 13 years as a general pediatrician before I moved back to Nassau County. I was in private practice for 4 years in Glen Head, and then I came back to NICOM in 2008, where I served as a faculty member. Since 2008, I was the director of a problem-based learning curriculum here at the medical school, and then last year became the Associate Dean of Student Affairs. I also see pediatric patients in one of our outpatient clinics out in Central Islip, where I see patients with medical students. What was my inspiration for being a pediatrician? I have to say it was when I was a young child and I came from a difficult home situation, and I always wanted to do something that would help another child get out of that situation. That was my driver. I had a physician, a general practitioner. Her name was Dr. Wasserman, and she was my inspiration for the type of physician I would become. It struck me as pretty shocking, as she was the first person that I had seen tattooed from being a prisoner during World War II, during the Holocaust. And I thought, wow, what an incredible survivor. And I related to her because I saw myself as a survivor as well. She was frank, to the point, a no-nonsense sort of person who put patient care above all else, and that was something that I wanted to aspire to. What is the best part about medicine for me? I've been pretty lucky that in the sunset of my career, I am able to be with medical students with the future of medicine. But I think what warms my heart the most is that I am practicing quality healthcare in a high-need, low-income community. And that's where I feel the most comfortable and enjoy myself. So when we ask, how do you get through a stressful day and lots of patients, that's what drives me, my patients, affecting their lives in a positive way. How do you manage stress? Oh, gosh, if I had the answer to that, I'd be a pretty wealthy woman. I think there's one main trick that I use during the day when I'm in patient care, and it's actually something that I learned while I was practicing or working with Kaiser Permanente, where they stress thriving in a busy practice, and that is learning how to deal with one or two problems at a time when the patient comes in with a whole list of problems, prioritizing, validating their concerns, but really honing in on one or two issues and then bringing them back to deal with other issues. Otherwise, seeing many patients during a day with multiple complaints and concerns, it can be very draining on the practitioner. So that's been very helpful for me. If I were to give one piece of advice for future medical students or future physicians, is to do what brings you joy. If I were to do it all over again, I would choose the exact same specialty. Children, babies, teenagers, young adults actually bring me joy. I love to interact with them. I love to laugh with them and cry with them. And what I hope each day is have a positive impact on their life.